Hey, how's it going, everyone? This is FixerMed. Welcome back to my high yield anatomy review series for the USMLE Step 1 NBME CBSE and NBME CAS examinations. This will be part 22 of my multi-part video series giving a broad overview of the discipline of anatomy for these exams. So without further ado, let's go ahead and get started on today's content. I'd like to continue off from part 21 and talk about the direct inguinal hernia to complement the discussion we had about the indirect inguinal hernia. So direct inguinal hernias account for approximately 15% of all inguinal hernias. During a direct inguinal hernia, abdominal contents protrude through the weakened area of the posterior wall of the inguinal canal, typically medial to the inferior epigastric vessels within the inguinal triangle, also known as Hasselbalch's triangle, and subsequently through the superficial inguinal ring. Unlike indirect inguinal hernias, direct hernias do not descend into the scrotum. This type of hernia is more common in older men with weakened abdominal muscles. Direct inguinal hernias are rare in women, and when present, they are often bilateral. Let's go ahead and move on to the next concept. Next, I'd like to discuss the peritoneal structure, known as the lesser omentum. The peritoneal structure, the lesser omentum, comprises two ligaments, hepatogastric and hepatoduodenal. The contents include the right and left gastric vessels, connective and fatty tissue, and the portal triad components, which include the bile duct, portal vein, and proper hepatic artery. Let's go ahead and move on to the next concept. Next, I'd like to talk about the epiploic foramen, also known as Winslow's foramen. Anteriorly, it is bounded by the free border of the hepatoduodenal ligament housing the portal triad, known as the bile duct, portal vein, and hepatic artery. Posteriorly, adjacent to the inferior vena cava. Superiorly, it is adjacent to the caudate lobe of the liver. Inferiorly, it is adjacent to the first part of the duodenum. We'll be going into more detail about this in the GI review series, so keep this in mind as you're reviewing through the material. Let's go ahead and move on to the questions. So we have a 65-year-old male who presents with a painless bulge in the groin that appears during activities such as lifting heavy objects. Physical examination reveals the protrusion medial to the inferior epigastric vessels, which does not extend into the scrotum. What type of inguinal hernia is most likely to be present in this patient? Alright, I think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. So direct inguinal hernias typically occur in older males with weakened abdominal muscles. They present as painless bulges in the groin, often exacerbated by activities such as lifting heavy objects, unlike indirect inguinal hernias which pass through the deep inguinal ring and may descend into the scrotum. Direct inguinal hernias protrude through a weakened area of the posterior wall of the inguinal canal, typically medial to the inferior epigastric vessels, and do not extend into the scrotum. Therefore, the correct answer is C, direct inguinal hernia. Let's go ahead and see why the other answer choices are incorrect. Indirect inguinal hernia is incorrect as it typically presents with a bulge that descends into the scrotum and is more common in pediatric patients. Femoral hernia is incorrect as it presents with a bulge in the upper thigh and is more common in females. Umbilical hernia is incorrect as it manifests as a protrusion at the umbilicus, also known as umbilicus, and is not associated with groin bulging. Ventral hernia is incorrect as it refers to a hernia along the midline of the abdomen, not specifically in the inguinal region. Incarcerated hernia is incorrect as it describes a hernia that becomes trapped and cannot be reduced, which may lead to complications such as bowel obstruction or strangulation. All right, now that we got that, let's go ahead and move on to the next question. Which peritoneal structure consists of the hepatogastric and hepatoduodenal ligaments and contains the components of the portal triad? Alright, think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. The lesser omentum is a peritoneal structure that consists of the hepatogastric and hepatoduodenal ligaments. It contains the components of the portal triad, including the bile duct, portal vein, and proper hepatic artery. The lesser omentum plays a crucial role in connecting the liver to the lesser curvature of the stomach and the proximal part of the duodenum. Therefore, the correct answer is D, lesser omentum. Let's go ahead and see why the other answer choices are incorrect. Greater omentum is incorrect as it is a large fold of peritoneum that hangs down from the greater curvature of the stomach, covering the intestines like an apron. Mesentery is incorrect as it is a fold of the peritoneum that attaches the intestines to the posterior abdominal wall, providing support and containing blood vessels, lymphatics, and nerves. Falciform ligament is incorrect as it is a ligament that attaches the liver to the anterior abdominal wall and diaphragm, dividing the liver into right and left lobes. It does not contain the components of the portal triad. Peritoneal fold is incorrect as it is a general term that can refer to various folds and ligaments within the peritoneal cavity but does not specifically describe the lesser omentum. Let's go ahead and move on to the next question. Which anatomical structure is bordered anteriorly by the free edge of the hepatoduodenal ligament and contains the portal triad, posteriorly by the inferior vena cava, superiorly by the caudate lobe of the liver, and inferiorly by the first part of the duodenum? Alright, I think I gave you guys enough time there. If you need more time, please feel free to pause the video. Otherwise, moving on now. The epiploic foramen, also known as Winslow's foramen, is a small opening in the peritoneum located posteriorly to the hepatoduodenal ligament. It serves as a communication pathway between the greater and lesser sacs of the peritoneal cavity. This foramen is bordered anteriorly by the hepatoduodenal ligament, which contains the portal triad, bile duct, portal vein, and the hepatic artery. Posteriorly, it is adjacent to the inferior vena cava, superiorly to the caudate lobe of the liver, and inferiorly to the first part of the duodenum. Therefore, the correct answer is C, epiploic Winslow's foramen. Let's go ahead and see what the other answer choices are and why they're wrong. The falciform ligament is incorrect as it is a fold of peritoneum that attaches the liver to the anterior abdominal wall and diaphragm, dividing the liver into right and left lobes. It does not form the borders of Winslow's foramen. Foramen ovale is incorrect as it is an opening in the interatrial septum of the fetal heart, allowing blood to bypass the lungs. It is not related to the anatomical structures described in the question. Greater omentum is incorrect as it is a large fold of peritoneum that hangs down from the greater curvature of the stomach, covering the intestines like an apron. It does not border Winslow's foramen. Lesser omentum is incorrect as it is a peritoneal structure consisting of the hepatogastric and hepatoduodenal ligaments, connecting the liver to the lesser curvature of the stomach and the proximal part of the duodenum. It does not form the borders of Winslow's foramen. Round ligament of liver is incorrect as it is a fibrous remnant of the fetal umbilical vein connecting the umbilicus to the liver. It does not border Winslow's foramen. That will do it all for content today, guys. If you have any questions, comments, or concerns, please feel free to list them in the comment section below. Also, would appreciate it if you could like and subscribe to the channel if you enjoy content like this. If not, this is FixerMed signing off. Be sure to have a great day, everyone, and good luck studying. Goodbye.